Yes, thank you to all those participants in this session. Good morning, good afternoon, and good evening. Welcome to 1539th day of continuous and uninterrupted Zoom session of IFPH. Let us start the proceedings with a silent prayer for 1 minute. Thank you and welcome back. Today we have with us a new guest, Dr. ELANTHIRAIYAN MD, Homeopathy, guest professor, Excel Homeopathy Medical College, Komarapalayam, Erode, Tamil Nadu, India. Chief Consultant, Sindra Homeopathy Clinic, Salem Complex, Metro Street, Salem, Tamil Nadu. Winner of many awards, has done many talks on homeopathy at various channels, written articles on homeopathy at various newspapers and magazines, and active person in social media. The topic is efficiency of homeopathy, efficacy of homeopathy in the management of psoriasis. On behalf of IFPH, and welcome, Doctor. You can have the platform for next 40 minutes or two. Please proceed, sir.
Good evening, doctors and well-wishers of homeopathy. Today, I am going to talk about psoriasis, efficacy of homeopathic treatment in the case of psoriasis. So, psoriasis as such, it is a chronic, non-infectious chronic inflammatory disease with erythematous plaques with the scale formations, scaly eruptions. That is the character of psoriasis. It first primarily it affects the skin. It is a disorder which is having a high prevalence in the European population. With it is less common in African population and in some of the Asian population, like Japanese, it is less common, seen to be less common. Here we have plenty of cases coming out with the psoriasis. As far as the age incidence of this particular disease is concerned, it affects from 5 years, children at the age of 5 years to as older as 100 years, 107 years, people are also affected. So there is no upper limit for age, but the minimum age group is 5 years. Below 5 years, psoriasis seems to be very uncommon relatively. So this is about the age incidence of this psoriasis. As far as the etiological factors is concerned, the cause of psoriasis is concerned, it seems to be a multifactorial disease. Primarily, it is of immunological. There is a immunological reaction. There is a inflammation, and as well as there is a increased cell turnover in the epidermis of the skin. So these are the three basic changes, basic causes are the pathophysiology of this particular condition called psoriasis. So earlier it was thought that primarily it is a cell proliferation or cell mitotic division is increased. But in the recent studies show that before the cell proliferation, before the cell mitosis, there is a, more importantly, there is a inflammatory response. There is an inflammation in the epidermis, and then followed by a increased cell turnover. That is a mitotic division. So that is a recent research which shows that this is a case. And there is also an autoimmunity. So this disease is related to be an autoimmune disease, and also there is a strong genetic prevalence. So there is a genetic predisposition to this particular disease in most of the cases, and also infectious origin. In some cases of children, streptococcal infection also followed by eruptions of psoriasis. And also there are other causes like trauma after injury or burns or injuries to the skin, and the area of affected area of the skin, there is a development of psoriatic lesions. This is called as Kobnus phenomena. There are the other types of psoriasis also. There are several types of psoriasis. The principally the etiological factors. So it is a little bit of a very complex phenomena. So the genetic background also, it's a more complex phenomena. It is in when one parent is affected, the chances of child getting psoriasis is high. But whereas when both parents are suffering from psoriasis, the child getting affected is less common. So that is a genetic. So the slide shows cases which I have been treating with our homeopathic medicines. So the psoriasis is relatively a more difficult skin disease when compared to the other skin diseases. The other skin diseases are mostly of infectious origin or allergic in manifestations. But psoriasis is a little more difficult, refractory to several treatments. But whereas in homeopathy, we have a efficient treatment methodology for treating the cases of psoriasis. So there are several types of psoriasis which are seen in cases. So principally it affects the scalp and also the other areas of the body. Why it affects more often, why it affects the scalp is the exact reason is not known to us. But majority 60% of the cases the scalp is affected with scale formation. As we know, the hallmark of psoriasis is a formation of white silvery bran-like scales. That is the hallmark of psoriasis. So it is said that even we can take a bucket of scales can be collected from a patient who is suffering from generalized psoriasis and also scalp psoriasis. So such is the white silvery scale formation. This is again due to the increased growth in the epidermic layer, increased cell proliferation. The mitotic division in the epidermis takes place 30 times more than the normal cell division. So that is another reason. So genetically, it is more important. And also, it is found that the HLA antigens, the people with the HLA antigens are more prone to develop psoriasis, especially HLA CW6. So this type of people having these genes, HLA CW6, they are more prominently affected by psoriasis than the others. And also, as I said, in children, the streptococcal infection, streptococcal throat infection is followed by, in some cases, followed by psoriasis in children, especially that is called as guttate psoriasis. So, as I told, the types of psoriasis. So, the general, commonly, widely seen psoriasis is a scale formation. So, there is a eruptions are formed with white silvery scale formations, especially when you remove the top layer or scrub it, then you see the scale formation. And when you remove that scales, there is a bleeding spots also underneath the scale formation. So this is the common type which usually affects the scalp and behind the ears and back of the head, and also the extensor surfaces of the skin are more commonly affected. The predilection for psoriasis, though it may affect any part of the body, especially the front and back of the chest, so more commonly, more prominently, it affects the extensor surface of the joints. So both the small as well as larger joints are also affected in the case of psoriasis. It's not only smaller joints, but also especially the joints like the knee joint, the elbow joint in the hands, knee joints, and such flexor extensor surfaces are predominantly affected. So to make a diagnosis of psoriasis, the scaly eruptions on the extensor surface of the joints is one of the key guide to us in the making the diagnosis of psoriasis. So this is about the thing. And also there is a severe itching in cases. In some cases, we find in clinically patients report that there is no itching at all. Maybe they undergo a lot of treatment and also they are suppressed in the treatment. So mostly, primarily it is a skin disease. But when it is suppressed or in later stages of psoriasis, it from the skin it jumps to the joints and causing psoriatic, what we call as psoriatic arthritis. So this is one of the important sequelae of psoriasis. So primarily there is a epidermal thickening. So in when scalp is affected, there is also alopecia, hair loss, because it also affects deeper layers of the skin like epidermis, dermis, and hypodermis. Subcutaneous tissues are also affected, and the hair roots are affected. Hair follicles are affected. So leading to the hair loss, alopecia also is there in psoriasis we see as a common phenomena in psoriasis, and there may be bleeding spots. So these are all the symptoms of psoriasis. So as far as the management is concerned, so in the other systems they have corticosteroids, especially when the systemic corticosteroids are given, there is a relapse of psoriasis. Psoriasis rebounds, comes again, or that temporarily there is a very good response for systemic corticosteroids, then but followed by the stopping of medicines, withdrawal of steroids, then again it reappears. So that is a problem with the psoriasis, and also very strong local applications, external applications in allopathic ointments. Also, after stopping the ointments, there is a rebounds and recurrence. So it is a very highly it's a refractory kind of the disease, having a strong immunological background. There is also inflammatory background for this case of psoriasis. Many people affected, and majority cases scalp is involved, and 60% of the patients are affected by scalp psoriasis. And also there may be the seasonal aggravation. Sometimes the sunlight also aggravates photosensitivity. Sunlight also causes aggravation of psoriasis. And these drugs, as I said, after stopping of the steroids, and such drugs also affect psoriasis. And also emotional aspects, as we see in homeopathy, we say psychological causes are more important, psychosomatic. So it is more true in psoriasis that emotional factors also might have a influence, as it is said in medicine, as it may have an influence on psoriasis. Emotional disturbances like a disease, anxiety disorders, anxiety per se may cause psoriasis. So it is very important from the homeopathic perspective, where we have to take the causative factor as a psychosomatic. So psychological anxiety and emotions are very important from homeopathic perspective, and also the genetic background, and also from that we derive the miasmatic basis of psoriasis. So the miasm also is very important to be considered when we come to the homeopathic treatment of psoriasis. As we say, the psoriasis as such per se belongs to the psychotic miasm. Because of the very many factors why it belongs to psychotic miasm is that there is a hyperproliferation, thickening of the skin, increased proliferation. So we can compare it to the growth, neoplasm, tumor growth, benign growths. We say, psychotic miasm is known for benign growths, benign tumors. So in that case, so here also there is though we don't call it as a tumor, so the pathology is that there is a hyperproliferation. So wherever there is a hyperproliferation, increased cell growth, cell turnover, along with the thickening of the epidermis, it is a feature of psychotic miasm. So there is also inflammation, and more importantly, autoimmune background, immunological background is also a feature suggestive of psoriasis falling into the psychotic miasm. And whereas it travels from psychotic to syphilitic, that is, when the disease gets worsened, when the lesions get worsened, when there is a structural changes, psoriasis, when it is persisting for long years, so 20 years, 30 years. So over the period of years, especially when it is untreated or maltreated by so many medications, when it is not cured, what happens is it goes in for destructive changes. Very much destruction takes place in the both layers of the skin, epidermis and dermis. And that in that stage, we also may consider, when it goes to syphilitic stage, we may consider the anti-syphilitic medicine. So we cannot say it's only psychotic. Starting from psychotic, fundamental miasm is psychotic, from where it travels to syphilitic miasm when there is a destructive changes, and along with that there may be pus formation, and such changes take place. Then we think of it as a syphilitic miasm, and try the drugs, syphilitic, anti-syphilitic drugs during that stage. And also when it travels to then joint, psoriatic arthritis also, again the psoriatic arthritis of autoimmune background, again we think of the psychotic miasm. So all features are predominantly of a psychotic miasm in this psoriasis as a skin disease, and we have a ample scope in the treatment of psoriasis when compared to the other systems of treatment. Many patients, they do come to us because they don't straight away say the slides we are seeing these patients, no, they more or less they suffer from minimum 3 months, 6 months to several years, 5 years, 10 years, 20 years. So what happens is they have tried one or the other systems of medicine during this period, either allopathic ointments or internally taking steroid or Siddha, Ayurveda, Unani, and other local country medicines. So after trying all those preparations, only they do come to us. So that means that there is an area of suppression. There is some amount of suppression when they do come to us, because a lot of ointments, they say, I have been applying ointments, these steroidal ointments, betnovate or like that for several years. So what happens is there is a suppression, and we know that suppression leads to internalization, especially the skin disease. When it is suppressed, it goes on to the respiratory area, may cause asthma also. So again, there is an allergic background for both psoriasis and asthma. So whenever there is autoimmunity and allergy, then undoubtedly homeopathy plays a very pivotal role. As you know, our medicines are very excellent results we give in allergic manifestations and also in autoimmune diseases, so also in psoriasis, and when it gets internalized to respiratory tract, because we know in embryology the skin, the epidermal skin as well as the respiratory mucosa, they derive from the same cells in embryo. So there is a close connectivity between the skin cells and the cells belonging to the respiratory tract. So once the skin diseases are suppressed, they go into diseases like asthma, asthmatic illnesses. So principally, and then again they go for treatment for asthma. So all these things do happen maybe when the patients come to us. So there are so many issues like this. So, and as far as the management is concerned, there is also, though they are not, we don't call them as causative factors, a variety of food substances do aggravate psoriasis at some point of time, because even though in textbook we don't find any specific such thing, but patients' history in the clinical studies, we find that patients after taking especially the meat items, non-vegetarian food, especially the seafoods do have a, they are very, the protein particles in the seafoods like fish, crab and all, prawn like this, there is some amount of aggravation. At least even though the disease is not caused by them, there is, I believe, because in my experience of 30 years of treating the skin diseases, definitely the seafoods and also the meat, chicken, all this egg and all, they have an allergic component and they do aggravate the illnesses. So we have to take into the consideration. So seafoods definitely do the food allergy. There is a food allergy. Even all other allergic manifestations, patients do come and say that there is some form of allergy. Even though we can say that the allergens per se cannot be sometimes avoided, but the patient who is allergic, who is sensitive, who is hypersensitive, who is idiosyncratic, so the patient has to be treated. So the allergic manifestation, hypersensitivity has to be treated. But I do advise my patients, see, coming with all these things, and they themselves admit that after taking such foods, I do get an aggravation. So I tell them, advise them to avoid those allergens, especially the known allergens. We cannot avoid everything because anything may be allergic. But what we find is, what is the, we ask the patients in the history taking, what is the food substance that is allergic to you? Or after taking which type of food it is aggravated, the itching is more aggravated, the eruptions are more severe. So they say, so those foods we advise them to avoid. Generally, I advise them to avoid the seafoods, chicken and egg like substances, especially in case of psoriasis. And also it is found that alcohol consumption, continuous prolonged intake of high quantity of alcohol also seems to have an influence on psoriasis. So the life food habits and these addictions must be avoided, because when we give medicines also, then only we can see the response, how it is responding. Because if we allow them to take everything, then we cannot see the response. And ask them to stop all other medications. And just when we start with the homeopathic medicines, and especially when they have undergone or they have taken the other treatments, especially like allopathic ointments and internal steroids. So I start with the Nexvomica to antidote the ill effects of allopathic treatments, or even for any other treatment, Siddha, Ayurveda also. We do not know the exact mode of action of the drugs which they prescribe in Siddha and Ayurveda. So we only know about homeopathy. So I advise them to avoid those drugs and be purely on our homeopathic medicines with good food, and avoid whatever the possible allergens that the patient has noticed. And we give a general advice to avoid some seafoods and chicken and other foods like additives, chemical items. Even nowadays we know this food adulterations are very, very common. Lot of adulterations have come, and nowadays the fast food culture is there, and they use various chemicals in the food like Ajinomoto, vinegar, and cooking soda. So even all this to be considered, because these chemicals also can have an influence on the chemical foods. The substances are added in the food for making of various foods, like as I said, the coloring powders, coloring agents. So all these should be avoided. Should be on a simple, good diet, green leafy vegetables like that. And that is also a very important aspect, because some people chronically may be taking some foods which are adulterated or which are containing some chemicals. So I advise them to avoid all this and start with especially when there is a long history of allopathic treatment, start with the Nexvomica 30. I give for 1 month, period of 1 month, or even little more periods to antidote the effects of the other medications and treatment. And then we come to the homeopathic treatment of it. There are, though, as we know, several drugs in homeopathy. Some of the important drugs, some of the hallmark drugs which I use with a very good effectiveness. I would like to present here the medicines like Graphitis, Meserium, Calliars, Arsenicum album, Arsenicum iodatum, Mercurius, sulfur, hydrocartel, asiatica. So these are some of the very important drugs, very leading drugs. Calichlor, Calliars, Calliiode also are very important drugs, which is Sepia is also I have been using on based on the symptomatology. As far as the Graphitis is concerned, as we know, it is a very important medicine, especially when there is Graphitis associated with the constipation. Graphitis is a remedy for psoriasis. Even though Graphitis also we say it is a remedy for eczema, even for psoriasis, it is a well-marked remedy, especially when it seems to be associated with the constipation. And along with that, there is also the ailments from the grief or depression. When there is a mental depression, psychological depression that is associated with the psoriasis, so we can think of Graphitis. And cold aggravation and amelioration by warmth, I give this medicine as a Graphitis with the cracks formation and all. It's a very good remedy. And again, Meserium also is also a noted remedy, especially for scalp psoriasis, especially for scalp where there is a large scale formation. And we know the Meserium characteristic, there is a on removing the scabs, there is a on removing the crust, there is a wet surface. So that is a Meserium, characteristic of Meserium. So for scalp psoriasis, mesothelium is also, even though these medicines also are effective in eczema. So psoriasis also, it is very helpful. Then again, hydrocortisone. This hydrocortisone is a very important medicine in psoriasis, because the basic fundamental pathology in psoriasis is corresponding to the area of action in hydrocortisone asiatica, where there is a thickening of skin, the hardening of skin, thickening of skin, the epidermal layer, which gets hypertrophied, or increased cell proliferation, the scale formation. Hydrocortisone is a very, very important remedy in the treatment of psoriasis. I have been using it with a very good results, hydrocortisone. And so based on this, we can go. And then anti-miasmatic, as we know, Thuja can be given as an anti-miasmatic medicine, since it is a very good psychotic drug, which again covers the psychotic background of autoimmunity, inflammation, thickening, hardening of skin, and along with the arthritis as a sequelae. So when both the joint involvement, autoimmune background with the skin disease, so as an antipsychotic medicine, Thuja also I have prescribed with a very good results. Especially when these remedies, indicated remedies don't work, we go for an anti-miasmatic medicines. And especially when there is a syphilitic changes, when there is a destructive changes in the later stages, when there is a pus formation, there is also called psoriasis called pustular psoriasis, where the palms are affected or the fingers are affected with the pus formations. So the palms and soles are affected with pus formations, pustular, we call it as pustular psoriasis. And also, so there is a, in psoriasis, there is also involvement of the nails, nummular psoriasis. The nails get removed from the nail beds. So that is also one of the features in case of psoriasis. So these are all the remedies which we, and the mercurius as an anti-syphilitic medicine also can be thought of in psoriasis, but mercurius contraindicated when there is a dry skin, or only when there is a moisture skin with perspiration, we can think of mercurius. In syphilitic changes, we can think of mercurius as a remedy. And arsenicum album is also one of the very important remedies in psoriasis, with taking into consideration the modalities of arsenicum album, very, very important. The aggravation by cold, amelioration by warmth, especially patients complain of itching at night, severe itching at night, midnight, so that the modality, the 12 a.m., 1 a.m. So the aggravation of itching is in arsenic album is a very, very important indication which we have to consider. So again, the Kali ars also, Kali ars is also a very important remedy, where there is also itching worse by undressing is a very important feature in Kali ars. So Kali ars also is a very important medicine. And also arsenicum iodatum, ars iode. So this arsenicum album, iodum, where there is a hardening, thickening, is again a feature of this particular medicine. As we know, there is also exfoliation, a very large eruptions. When there is a large eruptions, exfoliative kind of lesion with the scale formation, we can think of arsenicum iodum. So Kali ars, arsenicum album, iodum. So both arsenicum album component is very, very important, and it is a very good remedy in case of, very successful remedy in case of psoriasis. So we can think of that medicine. And also we have then borax. Borax again is there is a tendency to suppurate. Tendency for suppuration is a very important feature of borax, and also associated with acne in girls, along with acne eruptions on the face, is again a very important medicine, borax. Berberis aquifolium, again it is a very, very important. And in borax also there is a, every injury suppurates. There is a tendency for suppuration in borax. So we think of that remedy in case of any suppurations. So sulfur again is also again a very important medicine in case of psoriasis. And we can think of, as you know, sulfur is a very excellent remedy which gives very good results in a variety of skin diseases. As we know, sulfur is a anti-psoriatic medicine though, but it is also effective in the early stage of psoriasis, where there is a red erythematous eruptions with the typical thermal modality of heat aggravation and all this. We can also not rule out sulfur. Sulfur also is a very, very effective remedy in case of psoriasis. When these patients do come to us, we advise them to, we first of all educate them regarding what psoriasis is. And usually many patients nowadays, they think that it should morning applying the ointments, it should disappear in the evening. So the first of all, the idea about psoriasis, we have to educate the patients. We have to prepare them for taking a homeopathic treatment, which takes a longer period of time. So maybe what they think as a cure is morning we apply ointment, evening the eruptions fade away. So they think that is a cure. And again it is recurring for several years. They go on applying the steroids, steroidal ointments. Even I have seen cases where excessive use of these steroids for psoriasis, they come up with severe asthma, and again usage of steroids, the renal pathology, the renal complications like renal failure also I have seen patients, because very, very prolonged period of time by taking these steroids, they end up with asthma. Again, asthma again is another very big issue, problem. Along with the psoriasis, they come with the asthmatic illnesses and go on taking steroids. There is obesity. So these are all the and again thyroidinum is also a very good important drug for psoriasis, especially in obese patients. Thyroidinum, obese patients with the psoriatic lesions, thyroidinum is also one of the important drugs for in the treatment of psoriasis we see. And also sepia can also be thought of in case of psoriasis, where the if there is any in the eruptions are very offensive, so then we think of a sepia as a very important drug. So in syphilitic miasm also we have to think of syphilitic drugs. There is also a drug like nitric acid, phytolacca. We also think of acidum nitricum, especially when there is a cracks formation, palmar plantar psoriasis. Again, petroleum, I must not forget about petroleum, especially when there is a soles and palms are involved. There is also a type of psoriasis, we call it as when palms and soles are affected. Only patients suffering from psoriasis, only palms and soles are affected. And very importantly, we don't see the classical scale formation in the palms and soles. Usually there is a eczema like eruption, dermatitis like eruption. So clinically very difficult to differentiate between a palmar plantar psoriasis and a eczema, dermatitis, contact or irritant dermatitis. So most of the time it is confusing. But the palmar plantar psoriasis is also one of the types of psoriasis where only palms and soles are affected. So in such cases, when soles are affected, especially a very important drug is the petroleum is a very important drug. Petroleum also, especially for when psoriasis, what happens is there is a crack formation, very painful, and there is also bleeding is present on the palms and soles. So petroleum can be thought of when the palmar plantar psoriasis with a crack formation, painful eruptions. So petroleum is a very important drug. So we can so usually in this nitric acid also, acid nitricum also, when the soles are affected with the cracks, when there is a crack formation on the soles, we know nitric acid, acidum nitricum is a excellent drug. Whether it is batteries. when there is a battery logo. When there is an eruption in the soles with a crack formation, we think of a nitric acid as a very important with a very painful the cracks. Nitric acid, both wherever there is a pathology, whether it is in the anus also, fissures and fissures also, nitric acid, as we know, is a very important drug. Both the mucous membrane and skin, it causes fissures, painful, very painful cracks with the bleeding sometimes is a hallmark of acidum nitricum. So as far as the dosage is concerned, I usually start with the 30th potency. We don't go for higher, I don't go for higher potencies, since because they come with a lot of other treatments. Most of the cases are along with the psoriasis, there is a drug-induced drug side effects of the allopathic drug. So the natural disease, and again this the side effects, suppressions by allopathy, suppression by the treatment ointments, especially what the trend is in the general thing, whether it is an allopathy, ayurveda, siddha, they think as we know, the disease is only external, the disease is only confined to skin, and since skin is very much approachable and external, they think that the external treatment alone can cure the disease. But as we know, from homeopathic perspective, the vital force, miasms, all this take into consideration. So there is a huge amount of suppression in most of the cases of psoriasis. No patient, rarely they do come immediately after the eruptions start, they come to homeopathic treatment, because when all other systems fail, then finally, ultimately, they only come to homeopathy. It is not only in psoriasis, many of the diseases, the trend is when trying all other treatment methodologies, they do come to us for the treatment of homeopathy. In internal diseases, sometimes they are not able to, patients are not able to see the changes or the side effects. Say, for example, in a case of an internal disease like a liver disease or a renal disease, they are not able to, unless there are prominent symptoms, they don't know about suppression. They don't know that the disease is not cured. They cannot pursue most of the time. So they get convinced of the treatment. But in skin disease, one important thing is it remains as a mirror to the patient. So they cannot hide. Sometimes what they say is, it will be like that only. You have to take this ointment. You have to take these medicines. No other way. So they openly tell like that. So the patients also realize, so this is not curable by the other systems, though, then let us try homeopathy. Like that, they do come to homeopathy. So after that only we take up the case. So there is a some amount of suppression in majority of the cases of psoriasis when they do come to us. That is what I see in my clinical experience, except 5% of the cases where they straight away come and say that I have not tried any treatment. But then again, we have to believe their words. So we don't know whether they tried or not. But in other 90% of the cases, they do come with some kind of suppression or other allopathic treatment. So to avoid aggravation, as we know, homeopathic aggravation. So nowadays, people are not ready to see the aggravation. So they are not able to understand that homeopathy, there is a homeopathic aggravation. So to avoid the aggravation, start with the lower 30th potency in skin diseases, in all the skin diseases, whether it is allergy or psoriasis, because there is a likelihood of homeopathic aggravation. So to avoid that, I start with the lower potencies in any of the indicated remedy, the remedies which I have listed, start with the 30th potency and go slowly. So this is the method of treatment and followed by the placebo. So like that only the dosage is given, though it takes we cannot, normal eczema, if we are able to get results in 6 months or 7 months, the psoriasis takes 1 year or little more than 1 year. So only thing that we need to do in clinical treatment is the educate the patient. Very, very difficult task that is. But once we achieve that, once the patient understands that homeopathy takes a longer period of time, and even sometimes we have to explain our principles, our philosophy also, that homeopathy cures the disease from the root cause, cures the disease in its whole extent. So it takes the time, unlike the external ointments or the other system of treatment which suppresses. So we also have to educate the patient regarding suppression. So it is not a subject which is only to us. So to the patients also, we educate that most of the this one treatments suppressing the psoriasis by giving external ointment. So educating the patient is a very important this thing in order to achieve good results. Once he is educated, once he is prepared, that he should be prepared. Say, if 1 year of treatment, patients are shocked. 1 year, how can he take treatment for 1 year? And then we have to say, you have taken treatment for 15 years, it is not cured. So why don't you take for 1 year in homeopathy? So like that, we have to educating the patient is a very important factor in order to achieve success. So more than a year. So we go by slowly with these medicines along with the food restrictions. Even in when we treat cases of psoriasis, I advise them to avoid treatment for other illnesses. For example, what they do is they suddenly get a cold or cough or fever. They go to a allopathic doctor and take some antibiotic or antipyretic, dolo, like that. They take other medicines. Even those medicines seem to aggravate the skin disease. It's not only that the skin treatment, but also treatment taken for other illnesses also. What I advise is, whatever illness you have during this course of treatment, whether you have a common cold, you have a fever, you have other illnesses also, only homeopathic medicine should be taken to avoid the other systems of treatment. Even that has an influence on our skin, because skin is as we know, even an antibiotic. I have seen in case of psoriasis during that 2-3 years back, during the COVID time, when one of my patients was improving very much, suddenly for 1 week she took treatment for fever and cough, and everything got exacerbated. Now what happens is they blame on us. See, doctor, I was taking treatment, it was improving, I was happy. Suddenly this is coming up. Then I said, what did you have any other problem? Then she said, I had fever, cough. Only 1 week I took medicine, sir, not more than that. But 1 week medicines taken for fever and cough caused a severe aggravation of psoriasis. So our medicines, even though they are bringing good results, a little 1 week of antibiotic course and antipyretic can severely interfere with the treatment of psoriasis. That is what I have found in my experience. So these are all the intricacies, and effectiveness in psoriasis is good. We are able to give good results. The only thing, the results based on the duration they have suffered and the variety of treatments which they have taken. So all these things influence our outcome of the treatment. Otherwise, we have a ample scope in the treatment of psoriasis with very good results. We can revert it unless they go for a very end stage disease. So we are able to give because psoriasis in the skin disease, psoriasis is one of the very refractory treatment, very difficult to cure in the other systems. Even in those in this area, we have a good scope. That's what I wanted to tell to the doctors and the public people. Sir?
Yes.
Yes, sir.
Okay. I have finished.
I shall continue, or you said some question answer
Yes. Somebody is
discussion is there.
there. Yes, that is a normal procedure.
Ah.
If anybody would like to participate, please raise your hand. You can ask some questions as well as being the most experienced physician in this platform. You can also give some suggestions also. So kindly raise your hand. You rightly mentioned about the cause of disease. The miasm is the cause, definitely, and the other factors are only the exciting or maintaining cause. That's the most important, most remarkable thing. Without the miasmatic influence, nobody will get chronic diseases. As mentioned by Dr. Samuel Hahnemann, the horse 206 footnote, till not cause a disease. These are two insignificant to cause a chronic disease. To continue for years and to aggravate year by year. So that's the most important thing. Then you mentioned about different medicines and your this prescription strategies. First, you antidote the medicine with Nexomic or other medicines for 1 or 2 months. Then you start the medication. That's an also good suggestion. Then mentioned about a lot of medicines and the indications, especially the Kali, the potassium salts, Kali iodide,
Yes,
Kali
yes,
chloritum,
yes.
Kali bromatum, then the hydroxyl asiatica, thyroidum, then you mentioned about the miasmatic background, Tuja, then acetic case in case of this cracks and there this nitric acid indicated. What about the success rate in this case?
Yes, sir. Success,
Yeah.
75 to 80% success rate we are able to give, sir.
Yes, that's great. Did you publish
Yeah,
all
75.
these in any journals?
Yeah, I have published, not journals, sir. I have seen in my clinical experience, and in the future courses, I can present the cases also before and after treatment like that also, because I have not prepared that since short notice. In future, I can present the cases also before and after treatment.
Yes, definitely that's good.
Yeah.
But what is more important is
Only thing is, if it is of a very long duration, sir. So some people with a lot of medications after 20, 30 years of psoriasis. So such cases may take longer period of time. And if they are cooperative, even in those cases, we can give results. But most of the time they are not cooperative. They say their expectations are very high. They have taken so many of medicines and steroids and other things, but they are not able to understand that the suppression has taken place. And even some patients do come with asthma after taking this suppression of the skin psoriasis. They develop asthma, and they have taken steroids for asthma, lot of bronchodilators and all these things, when they do come with such extreme level only, then the outcome will be poor, not expected. But plain cases without the suppression or the secondary going to the other sectors, when they primarily come with the skin lesion, we give good results.
like mentioned by
Reasonably a good duration, like 5 years, 7 years, 10 years, and all, we are giving good results. Some very chronically ill patients, 20, 30 years with so much of allopathic medications, there again, I will assess that and tell to them that is not much can be expected since because of 20, 30 years of medications, not because of psoriasis per se, because of the medications they have taken.
Suppression.
As Hahnemann said, it is very easy to cure this natural disease, but very difficult to cure the artificial chronic disease produced by the drugs, allopathic drugs. So that is that I have seen in these extreme cases.
Yes, I think
What Hahnemann said is very much truly applicable in cases of psoriasis. Very difficult to cure these drug diseases created by the allopathic medications.
Yes.
In that cases, we tell to the patient that what is the outcome, what can be the outcome. That's all. We can't say that I will cure everything, that and all I don't say. So I said 5 to 10 years without much of going to the other suppression and going to the other systems, and not too much of medications. So those cases, cases coming to me, if 10 cases coming to me, 7 to 8 cases are in that good stage of curable conditions only.
Okay, that's the question in the chat box. Which medicine is better for asthma, alternate psoriasis?
Arsenicum album.
Yes.
Arsenicum album we can think of in asthma alternating with the psoriasis.
Yes. Then what about the diet and regimen in such
Yeah.
cases?
Yes, the diet, as I said, the known factors, patients do say some allergens. I get aggravated by after taking this food, I get aggravated. I ask them to avoid such foods. So they will have a note. Some people have a note of foods. So 5 items, 10 items. Even in a vegetarian, taking a dal causes an allergy. Taking groundnuts causes allergy. Some patients say like that. So there are, as they say, thousands of allergens which we do not know. We cannot say this is allergen. But there are some general allergens which I say is the non-vegetarian food, especially the seafood. If they can avoid all non-vegetarian food, well and good. Or if not possible, at least the seafoods are more allergic than the chicken and mutton meat. Seafoods are known allergens, as we know. Most of the cases of skin allergy, dermatitis, eczema, psoriasis, the seafoods are very highly allergic. Prawn, fish, and all this, crab, all these things. So seafoods are asked to avoid generally, but if non-vegetarian food can be avoided, very good. And also I give specific advice regarding the chemicals used in the food. Like as I said, Ajinomoto, vinegar, cooking soda, and all these foods should be avoided. And good green leafy vegetables and other vegetables can take. Pickles and mainly pickles, they are put in the salt, so that causes some aggravation. So pickles, lemon, citrus fruits.
Yes.
Usually cause some allergy.
Yes, there's a common chat box.
Citrus.
Anxiety, apprehension, associates psoriasis in very fastidious patient.
Yeah, graphite is again, graphite is for depression, anxiety associated with psoriasis, and arsenic malbum also anticipatory anxiety. We can think of arsenic album, graphite is. So based on the symptoms also we can go, so many other drugs also will cover. Suppose if there is other characteristics, mental characteristics, we can, based on that also we can give. It is not that only these drugs are, so these drugs are more useful, more, more pathology oriented or more symptomatic, local symptom oriented drugs which I have listed. But apart from that, there is some unusual. Natromur also is one of the important drugs for psoriasis. Natromur also. Okay. So constitutional medicines, whether it is a lycopodium, silicea, calcarea. Calcarea again I have missed. Calcarea, very good medicine for psoriasis, scalp psoriasis. Calcarea ars, calcarea flor. They are also. Calcarea carb is a very good medicine for scalp psoriasis as such. So if the other constitutional factors, features like obesity, perspiration on the scalp, so these things also we have to take into notice. Not that I have just given a therapeutic list, but it is not the end. So if based on the constitution, the patient is obese, slow, and the perspiration on the scalp, slow to everything thinking and all that, calcarea is the constitutional remedy. Give calcarea.
Yes. What is your opinion regarding the dose of the medicine?
Yes, low potency, 30 potency
that
is
is
ideal.
Potency. No, that is potency.
Constitutional medicine, I give a single dose, thuja, sulfur. I don't repeat often because long-acting medicines. But the other medicines like graphite is, I give on the basis of weekly once, and sometimes daily doses. And if there is
whether it is dissolved in water or dry upon tongue.
Which one, sir?
Whether it is dissolved in water or dry upon tongue. Which is the method you apply?
Directly on the tongue.
Yes, that's good. Yes.
Not water, directly to the.
In the case of the patients, when they are more sensitive, it's better to use the old-fashioned dose, I think. Dr. Hariharan sir, do you have any suggestions, sir? Yes.
Yes, sir.
Dr. Hariharan sir, please unmute. One of the senior persons in this platform. Yes,
okay, very good class. Very good. But but we see in regarding dose, regarding the method of administration, see 50 millismol LM potency is very good.
Very good. Okay, sir. I will take that suggestion, sir. But since it is to avoid aggravation, I start with the 30 potency. LM also, I will also take into that consideration. It will be useful for me also because I am mainly concentrating on the skin disease, especially psoriasis. So I will also take your advice, sir, as a senior person. Your advice also I will take, and also I will try with that, sir.
Okay, sir.
Thank you, sir.
Yes.
Being it is a psychosomatic disease. See, according to the mental symptoms, see, we must prescribe for the psoriasis, and you will get
definitely.
You will get very good results. Along with that, see, along with the homeopathic medicine, we can use the black flower remedies also. See, in black flower remedies, one of the medicine is crab apple. Crab apple,
I know, sir.
crab apple.
Sir. Yes, sir.
Along with homeopathic medicine, see, this will also give very good result.
Okay, sir. I will take.
We can cure the psoriasis, and I have get a lot of result. But only thing is that it will take a long time, very long time, and and the restriction of food is, say, usually patients are not like the restrictions of food.
They don't want food restrictions. That is that problem also is there. So I don't put so much restrictions like in Siddha and all in Tamil Nadu. They give a lot of list of food items to be avoided. So very difficult to follow that. Some patients complain. So in I don't give so many restrictions. Coffee, coffee, tea as a general lesson. Alcohol avoid, and food.
Yes, you have already described all this.
Yes,
please.
Yes.
Hello. Can you hear?
Yes, madam. Yes,
madam. See, for Dr. Hariharan told, bachelor remedy, crab apple. If patients are also very good for this severe itching, they will be having severe itching.
Yeah.
So in that case, we can give impatience. As well as the scales are there, more scales are there, then we can give acid trisorobinic.
Acid crisorbin, that also is one of the therapeutics. Acid crisorbin,
especially 3X. I used to give 3X saturation powder. Not
lower potency. That's what. I agree with that. Yeah.
It works very well. That's all.
Yes.
It was a very good session, doctor.
Thank you, madam. And Artica urens, when there is severe itching,
surely.
the indicated medicine also does not give results, I give in the as an intercurrent. Artica urens, patients complain of severe, intense, intolerable itching. Artica urens is a very
hydrocortisone also.
Hydrocortisone. Hydrocortisone is a routine.
You are told. I already told.
Thank you, madam.
Just very good session, doctor. Very good.
Thank you, madam. Thank you.
There is a suggestion from Dr. Jayalalitha. X-ray is also a good medicine, Dr. Jayalalitha.
X-ray, radium bromide also. I have forgot to say that X-ray and radium bromide also is one of the important drugs for psoriasis. X-ray also, that is also. I have written.
Definitely, we are fortunate enough to have so many medicines in homeopathy, and also doctor said about the 70% cure recovery rate is wonderful and amazing thing, and it must be published at the earliest. So it's time to conclude the session. May Dr. Ramadevi Ambadi is a regular participant, one of the senior most and independent physician. Please proceed, ma'am.
Hello. Thank you, doctor. On behalf of IFPH as well as on behalf of me, I convey my gratitude. You come again. It was a very good session. Very nicely you have explained. Very good. Come again.
Thank you. Yes. Thank you.
This is a long marathon session of 39 days passed uninterrupted by God's grace. There is no doubt about that. And he is the first, his maiden presentation is also a nice one. You continue your endeavors and also to participate, not only you, but the students. They are the future of homeopathy. Let them force them to attend. Definitely they will continue. With that remark, we conclude today's edition. Hope you will be back again tomorrow. Till then, goodbye. And Dr. Mariama John to continue the program. Thank you.